Hi everyone. Now we are going to discuss about the ethical and legal issues in psychotherapy. Okay, let's start. The ethical and legal issues in psychotherapy. It is a vast area, and this ethical and legal issues are very important in psychotherapy. Every therapist and counselor should follow the ethics which have been designed. So this ethics should be followed by a therapist or counseling psychologist to deal with the patients or client. So this very important role for the therapist or a counselor. So let's discuss about the ethical and legal issues. First is competency of therapist. It is defined as the ability of required skill, knowledge, qualification, or capacity. So the therapist should have a proper skill related to the subject and knowledge, and should have proper qualification, master degree in psychotherapy or counseling, etc. So the and also other capacity to do or deal with the counseling session. This is the first and major role ethics. Next, it is very important that therapists are aware of their competency with regards to the level of his or her knowledge, training, and supervised experience in particular kind of therapy. The therapist should be well versed and specialized in a particular type of therapy, which are well versed for them to deal with the patients with the illness or psychological issues. So, emotional competency is this actually means whether the therapist is aware of his emotional state while dealing with their clients. Whether the client is like emotionally imbalanced or balanced, they should read their mind. Okay, they should be aware. So that should comes from the practice they have and from the practice they have already made. So this emotional competency is very important to deal with their clients. When a therapist became aware of personal problem that may interfere with performing their duties adequately, where suppose, say for example, the therapist faced an emotional problem related to their marital life. Okay, they have the same issue with the client is reporting. On that time, the therapist should confirm or make that sure that he will be full-fledgedly follow his client without any disturbance. Once if he faced any disturbance in the management of client, then he should move on or end up with the therapy, and he can refer or he or she can refer a psychotherapist who is capable for this particular issue. Whereas with the same problem, he or she should not deal once they are not confident. Okay, so such professional they can refer for the professional consultation or an assistant, which determined whether they should limit or suspend or terminate the therapy. If he is not confident enough about the problem which they can deal with that, then they can confidently move on to the or end up with the therapy session. So the responsibility to the self as a therapist, what are the responsibility? This is the second ethic. Should be a therapist should the therapist have? It is the responsibility of the therapist to maintain their own effectiveness, flexibility, and ability to help client. They monitor their own personal functioning and seek help or avoid doing from the therapy when their personal resource are sufficiently useless. And therapists should not undertake therapy when they functioning is significantly impaired by personal or emotional difficulties, whereas illness or alcohol, drug, or any other issue. Once they are in the therapy process, they should not be personally or emotionally faced any difficulties related to, so that time they should not take over the cases, whereas they are using inducing alcohol or drugs should be totally avoided, and that situation should be avoided. Thank you.